we're trying to build this kind of applying into PM&R section of our site. And so we have this very basic and rudimentary exploration guide for students without home programs in PM&R right now. What I'm going to do is I'm actually just going to switch that over to a Google Doc so that we can crowdsource more of this information. And I'm going to put the notes and everything up there. I'll actually just introduce our panelists. So we have Dr. Chowdhury here. He is the current medical director of the Cancer Rehab Center over at Columbia. Am I right, Dr. Chowdhury?
I'm at Cornell, but it's a dual campus program, so that's fine.
That's why. Okay. Well, thank you so much for joining us today. And then we have Dr. Alex Fry, who is the co-chair of our research committee, and she's a PGY3 over at Beaumont. So I will let them kind of take the wheel. And did you guys want to say a few words about yourself? I know Dr. Chowdhury, we haven't actually met in person, so but I read a lot about you and all of the amazing kind of mentorship things that you're involved in.
Don't believe any of the good stuff. Maybe Dr. Fry, you can go first.
Sure. I mean, I'll introduce myself first, but if you want to speak and then I can do like the presentation after, we can do it that way. So I'm PGY3 resident at Beaumont Taylor, which is basically in like the Detroit, Michigan area. I did medical school in Alabama, the University of Alabama at Birmingham. And now I'm at Beaumont. I'm thinking more general PM&R for fellowship, but we'll see where everything takes me. Go ahead, Dr. Chowdhury.
As you heard, I'm Nasim Chowdhury. I am the medical director of cancer rehab at Cornell. That's my outpatient practice. I'm actually an inpatient attending as well. So I actually did my residency also at Presbyterian. That's the, I guess, the hospital for Columbia and Cornell. Stayed on as a faculty member. So I'm going on my 7th year as an attending now. So almost 10 years in my institution. I work with residents every single day of the year for the last 7 years. I've had students, of course, from our home institutions, but rotating students all the time doing their sort of quote unquote, I guess, audition rotation. I have geriatric fellows, pain fellows, oncology fellows rotate through as well. We do have a medical school in the Middle East, and I've had students pretty much rotate from all over the world. I'm a member of the Cancer Clinical Science and Research Committee for the International Society of Physical Rehabilitation Medicine. And so because of that, I also have a lot of international ties with students and fellows and junior faculty. Thank you for having me. This is great. This is a passion of mine, actually, so I'm glad to be a part of it.
We're honored to have you. Thanks.
So I know I saw the slideshows. I'm very flexible. Maybe I can just have a sort of quick chat with you guys about my experiences on sort of both sides of this coin. When I was a student, I did an audition rotation at Presbyterian. I was at Columbia. I stayed on as a resident and of course had students with me, and actually I have even now a MS4 with me. So I'd definitely love for you to get through your slides, but I can give you a brief sort of overview of what I look for, if that makes sense.
That would be great. Thank you.
Great. So I forget which slide it was in. I think it was about asking for a letter and, managing those expectations and letting your attending know relatively early that you would be interested in a letter. It's always good to have a little bit of context. But I think in parentheses, whoever made the slide said that make sure you vibe first. I love that. The reality is us lofty faculty members are also humans. you're gonna get along better with some than others. And, certainly I think picking a faculty member that you have a good relationship with is important. But just generally speaking, I think a rotation is a great opportunity to see if, it's a place that you would be happy. Um, yes, you're only going to be there for 3 years, but you want to make sure that you're maximizing your education, and you'll find it much easier to learn when you're in an environment where people have similar interests and similar learning styles as you. And so, with my students, I always tell them, be yourself, but don't be so much yourself that you perhaps end up being acting unprofessionally. I certainly, I think, fell victim to that. Native New Yorker, we're a pretty loud mouth bunch. And as a medical student doing my audition rotation at Columbia, certainly, I made some off-color jokes, which are maybe wouldn't make any New Yorker feel uncomfortable, but I one of the recreational therapists actually pulled me aside and was like, "Hey, man, maybe you want to be a little bit careful with the remarks that you make." And it was great feedback. I actually appreciated her for doing that. So I think some of this goes unspoken, but dress professionally, don't be late, be willing to help. And having conversations with residents, I think, is critical. Certainly having conversations with residents or rather students that have rotated at a particular institution in the past is very important. Certainly you want to be yourself, but you also want to show that you're adaptable and you can sort of match the style and environment of the institution that you're at. There's a fine balance. I think that's probably the biggest thing when you're doing a rotation, finding that balance. You want to balance being inquisitive with maybe not being so aware of what's good timing for a question and what isn't. That was in one of the slides as well. Talking about picking your moments. If your attending is on the phone and being swamped with consults, maybe not the best time to ask a question. I personally go out of my way to manage expectations at the beginning of the rotation. These are what I expect from my students. I will give feedback, sort of throughout the rotation, and I'll have an end of rotation recap as well. I ask the student off the bat, if they're thinking about asking me for a letter. If your attending does not necessarily lay those expectations down for it, it's totally reasonable to ask. Some of the most successful students that I've had were the ones who were independent networkers. They certainly were rotating with me, but would do a little bit of research into their subspecialty. As an example, one of my fours who is from Cornell, Qatar, did weekend rotations while rotating with me at other away rotations. That's not necessarily mandatory, but she went out of her way to, look up the faculty members, ask me if I knew any of them, and in some cases asked if I was willing to make the introduction. I mean, that was such incredible initiative. It was great. It really showed me that this was a student, I think, who was going to succeed. I think probably the balance piece is my biggest message. Saying I don't know is probably one of the three most powerful words you have. Certainly myself and other faculty I know they have a pet peeve when someone doesn't know anything, whether it's your colleagues, residents, or students, and I'll just sit there and try and make something up. I think some of the most aspirational colleagues of mine are the ones that I look up to, the ones who are constantly saying I don't know and are willing to learn. I would also manage your attending's expectations. Again, as I mentioned, I ask my students how many other physiatry rotations they've had. it's incumbent on your attendings and your faculty to sort of manage their expectations as to what your knowledge base is going to be. For someone who's doing their very first PM&R rotation, I should be understanding, and hopefully other faculty here as well, that your knowledge base probably isn't as broad. I think that's sort of what I have for now. If you want to go through the slides, I can comment as you go through them, unless there are any questions now. Of course, I'm happy to fill them now as well.
That was great. Thank you, Dr. Chowdhury. Yeah, you're welcome to interject whenever you feel like it's necessary. And we'll, if you guys have questions, we can just get through this really quick, and then you can like put them in the chat, and then I'll answer them towards the end, if that works. All right, sounds good. So I put these slides together, so they're a little informal, but I thought that might be fun just since it's more of an informal chat anyway. So, all right. So first of all, how to choose the rotation itself. There's a lot of different options, like Roxy said on the website. There's plenty of options. We have a whole list out there. So I think the biggest question, at least for me, was where would you like to end up? Is it a certain region of the country? Do you have a family in a certain area? Where's your dream place? Is there a school that you've always wanted to go to and study at? So I think that's one of the biggest questions, at least at the beginning, and then you can start to narrow it down based on how competitive you are. And if you feel like you're not as competitive as an applicant, you might want to start with a place that you might have an easier chance of getting into and really seeing if that place would be a good fit for you. But I don't think you should, try purposely limit yourself too much either. It's good to get a good range of places, especially if you're able to do more than one. If you have difficulty, so on the VSAS website, there's a lot of difficulty, especially as there's different timing of when programs open up on the website, different months. It can be very complicated. So sometimes I recommend, depending on the program, like emailing certain people and seeing if you have connections to get you a way in. I know I was doing research with a place in Syracuse, actually, and so I had connections for away rotation up in New York, and so I kind of used those. Talk to people that and see maybe some attendings at your place have connections at other places, and they can reach out and get you a spot, or maybe you're able to email somebody on their website and go from there. Another great way to do it is ask the recent graduates, the people that just graduated, where did they go for their away rotations and what their experience was like, if they liked it or not. That can help a lot. Just kind of get the feel of different places. They can give you a lot of firsthand knowledge and recent knowledge as well. Things change frequently. And then maybe try to pick something that you might have less exposure to at home. Like maybe they have a spinal cord injury unit and you don't have that at your place, or maybe they have, more brain injury or sports or something that you're more interested in. That can be a way to vary your exposure and see if you like something different. You might say, oh, I never saw more spinal cord injury patients, but I really enjoyed that. And then you might pursue a residency program that has more of a focus in that. So those are all things you can think about as far as choosing it. All right, next up, we have resources. So there's a whole vast array of resources, as I'm sure, Dr. Chowdhury can tell you, and Roxy as well. My first go-to, at least in medical school, was Pocketpedia. It was my go-to. It fits in your white coat pocket. You can always bring it out if you're in clinic, in between seeing patients, or, after you round, something like that. I know in residency, we use the Cucarula book quite often, but it's pretty thick and it's not necessarily something that you travel around with, but there are PDFs around that you can look into, and that can be a good start for kind of more of broad range of what you're into. It's more of a review book for our boards, if you will. It definitely depends on which rotation you're in. So if you're an inpatient or outpatient, that can change it, as well as, you know, if you're doing just a brain injury a month or a few weeks there, or spinal cord injury or something like that, you might have a different different books that you might lean in towards. Lately, I've been interested. I've been watching a lot of videos on PM&R Recap, and I found that they might have been really useful for me as a medical student. There's a lot of questions like UWorld, and there's videos. It is a subscription service, so there is that. But you might do like a little short period of a subscription and see if you like it. I think there might be a free trial, but I think it definitely goes through more of like the foundations of you know, learning different parts of PM&R. Kind of goes through MSK and some ultrasound and things like that, which can be helpful. All right. Next up, so what to review? So like I said, depends on the rotation. You might do more of a subspecialty like spinal cord or something, or you might be in clinic, something like that. So really tailor it towards what you're going to be doing. Especially, you know, if you don't have a home PM&R rotation, definitely, like, you know, manage expectations like Dr. Chowdhury was saying, but it might be even more imperative for you to review because you don't have as much exposure from before. Definitely anatomy is a really good place to start. We you know, work a lot with you know, muscles, nerves, joints. It's good to review some imaging, especially like neuroimaging, maybe some like hips and shoulders to start off with. Just kind of like basics there, so you're able to ask, oh, what is that on that image, and, you know, be able to use some more educated words, and that'll make you sound like you know what you're doing, and you won't be as scared to ask specific questions if you have more of a foundation, I think.
Where
yeah.
having open conversation with the residents is critical. You know, they know the lowdown, right? They'll be able to tell you if there's a particular attending that likes to pimp, and you know, what sort of topics they like to pimp about, and maybe they can feed you some of the answers so you look good. That's all. You know, again, you know, as a student, you know, residents are such a fantastic resource for you. Even in just picking spots for your match. The reality is, you know, attendings are, as much as we like to think we're on the ground, we're removed from the nuts and bolts of how units run and how clinics run. And so you'll get a much more honest assessment of how things truly are the program from residents than you will probably from faculty.
Definitely. And yeah, questions are very attending dependent, and people like to ask, I mean, in my experience, attendings often ask similar questions that they've asked before. So it's a good thing to be aware of, for sure. Residents are your friend, definitely. So continuing, so as far as common pathologies to common joints, so think about like back pain differentials, maybe shoulder, you know, there's not just rotator cuff, there's all kinds of different things you can look for there, and that way you might be able to ask in the future, oh, is this thing, you know, have more educated questions. And then review just common treatment plans as well. In rehab, we definitely prefer conservative first as much as possible, and then go, you know, so rehab mainly therapy, and then, you know, imaging, we like our x-rays and MRIs and ultrasounds, and then towards more of a stepwise approach, we often do injections after that, and then surgery is usually something we reserve for the very end as much as possible. So just kind of see the different treatment plans depending on, you know, how emergent some of these things are. But a lot of this away rotation is learning as well. So I think maybe just getting your foundations at the beginning will help you a lot. Okay, so some common mistakes. These are just speaking from experience. So sometimes not speaking up enough can be an issue. You know, some people are really quiet, and that's great, but you know, they show who you are a little bit. You know, they do need to get to know you, and that you're in person. You do want to stand out. You do want to show how special you are. Now, there's always the other flip side of it. You know, don't talk about yourself 24/7, and you know, toot your own horn too much, but tell them, you know, what you're proud of, and if there's, you know, leadership things that you're doing, and make them excited about, you know, what you're doing and how active you are. That's a good thing. Definitely ask for a letter at the beginning, not the end. You can set up a meeting at the end though to follow up, especially with a program director or something like that. They often set that up for you, but it's a good idea to ask towards the beginning if there's an expectation for a meeting at the end. And then definitely, you know, talk to the attending about, you know, especially an attending that you vibe with. I think I put that in later, but make sure that it's at the beginning and not the end. And then so they can see how you are, they can take notes, and then they can have these little personal tidbits to write in your letter that can go a long way. And then just show effort, you know, put the hours in, you know, get there early, don't be late, and you know, work hard. But it's also okay to leave when they say, you know, you don't have to push too hard when the end of the day comes as well.
So everything I say is very attending dependent, but one of my other personal pet peeves is just having a student, or even a resident for that matter, just kind of follow you around everywhere. I love, you know, teaching rounds and doing everything together, but you know, being attached at the hip, certainly it can be a little uncomfortable for everyone, especially if you're just getting up to go to the bathroom or something, right? And you're like uninvited, and you're kind of like looking over your shoulder, and they're, you know, an MS3 and MS4 and a brand new PGY2, and everyone's sort of falling into the bathroom. May or may not happen to me, but you know, it's so important, again, I think, to communicate. You would hope your faculty member is genuine and means it when they say, hey, you can go, and they're not going to hold that against you. Have I heard horror stories of, you know, old school faculty saying things and not meaning it? I think one of the easiest ways to avoid that is very briefly at the end of the day, you know, let your attending know, hey, I've chatted with resident X, we've gotten all this stuff done, anything else I can help you with? And that's a sort of, that's a non-aggressive invitation to your attending to either let you go or say, hey, actually, you know, there's something you would find interesting. If your attending says it would probably be good for you to observe XYZ or read up on this, probably do so. I think that's a good tip. When I tell my residents or my students to go, I genuinely mean it. And again, as I said, you know, the communication's key.
Yeah, that's a key phrase that everybody knows. Anything else I can help you with? I love that one. It's a classic. All right, next up.
Sorry, just one last thing that I was just thinking of. During, sorry, I keep like moving the camera. Someone basically, I remember as part of like my school, we had to like practice our 2-minute like elevator speech, and it was like it felt super weird, and I was just uncomfortable talking about myself. But I think starting off the rotation, just kind of with a 2-minute like little like sales pitch, like this is who I am. This is like, you know, you can mention like if you've done a PM&R away rotation before, where you're hoping to go, etc. I found that really like helps break the ice, because I think especially like what we're hearing from Dr. Chowdhury and Dr. Fry is that you really do want to like form a connection with people. And so I loved that advice of just like networking and really kind of showing initiative. I do feel like the little sales pitch kind of at the beginning helped. We had to practice it. And if you Google it, there's like a lot of kind of different elevator pitch examples that you can do. But it's basically, yeah, like a 2-minute sales pitch about yourself that I found helpful.
Yeah, it's a great idea. You definitely want to stand out because you're going to have all these, students rotating. You want to show them who you are. Definitely. Awesome. All right. So next up, what to say to attendings. So when to ask questions. This is something that took me a while to figure out. I would ask questions all the time, and sometimes they're trying to focus. Otherwise, they'll forget. They're doing something important. So just kind of keep a close eye and see what they're doing. If they seem like they're not as busy, go for it. When they're walking around, not working on anything, it's okay to bother them a little bit, but try not to get in the way too much. I think Dr. Chowdhury mentioned that earlier. Attendings love questions, so it really shows that you're interested. But it makes an even bigger difference when it comes from a place of knowledge and you're able to use great terminology. That goes a long way. Also, something I had to learn, it's okay to ask simpler questions, but try to look it up first. That can show initiative. Just some more basic ones. A lot of it's on Google and up to date, and you can ask a second level question sometimes too. You can say, oh, I looked this up and I found this, but what do you normally do? Or why did you choose this treatment plan? I saw that it was, like this, on up to date or on this thing, this often happens, but why do we do it this way? Something like that. That can really show initiative and what you're doing. Definitely, like Dr. Chowdhury said before, ask what they expect from you at the very beginning. Attendings have very different expectations sometimes, and they look for different things than you might expect. So it doesn't hurt to ask, and that way you know what to expect, and they know that you know as well. I mentioned it before, but ask for a letter at the beginning, but see how you vibe first. There's some attendings that you really you click with, and you guys understand, you get the feeling like they'll write you a good letter. Just make sure you kind of get a good vibe with them first. Ask them what they like about PM&R. They'll surprise you sometimes. They often are really passionate about their subspecialty if they decided to pursue one, and they can maybe convince you to try it or think about it. But they also often love talking about it too, and that's something that they get really excited about. So ask them why they chose the location that they chose. Ask them why they chose PM&R. There's a lot of different things. Why do you set up your clinic this way? Why do you do more EMGs? Different things like that. It can give you a lot of insight as far as what you want to do later on as well. And then ask for, if you're interested in doing case reports, ask for some cases that they think that are interesting, especially towards the beginning, so they can keep an eye out. Especially if you don't have a home program, that might be a really good way to get a case that you could present later on. And that way you could also make a deeper connection with that person if you're going to do a presentation with them later on. And so anything to add, Dr. Chowdhury?
I loved that point about asking the attending what they like about PM&R. The flip side of that's critical as well. You should have a well thought out, well formulated response to why you yourself chose physiatry. Mm-hmm. When I interview students, and actually, so the interview at Columbia Cornell's, it's like a panel of 6, I think we go consecutively. And the biggest sort of pro and con that's thrown about by my colleagues is whether the student had a good sort of understanding as to what physiatry was, which is a pretty closely related corollary to why you went into physiatry. That's critical. I think, showing, not necessarily having medical knowledge or minutiae memorized, but having a good answer to that question is critical.
Absolutely. Great point. All right, next up. So different ways you can be helpful. I mean, ask. That's one of the biggest ways. Sometimes they want you to write notes. Sometimes they don't. Sometimes they want to be more efficient and they'll just, go straight through, all the patients in clinic. You can help by seeing the patient first and writing something down. It really just depends on what they're interested in and what they want. That goes for inpatient as well. Sometimes they want you to pre-round. A lot of times they do, but not necessarily. And that also goes for residents too. A lot of times you do work closely with the residents and you just see the attending just for a bit, especially more like inpatient side of it. So ask your residents like, hey, what can I do for you? Can I grab something off the printer? Can I, anything like that? The little things really matter and they see the effort that you're putting in and that you want to help. They really do see that. And residents' opinions matter a lot as well. So they might not be the ones interviewing you, but the attendings do ask. And if you're helpful for them and you make them look good, they'll say good things about you as well. All right. And then ask if you can see patients beforehand and then present, especially in clinic. I wasn't sure at the beginning, can I go? Because that wasn't necessarily the standard, but I asked, towards the end of one of my rotations and they were like, yeah, it's a great idea. And so, you're able to have a little bit more autonomy that way and be one-on-one with the patient too, which can be really exciting, especially if you're at a different place. Sometimes they don't like that. They want to be more efficient. So it just really depends. And also, you might have the opportunity to present in an inpatient setting as well. But sometimes they prefer the residents to do that. So just ask, see what you can do. And the more that you're able to show that, you know what's going on and the more that you present and present well, that does show initiative and that looks good as well. Dr. Chowdhury?
Couldn't agree more. Personally speaking, I am much more forgiving of knowledge gaps. If I feel as if the student's coming from a place of sort of sincerity, if they have, done their due diligence and, let's say they're the ones responsible for doing an admission note and talking to the consulting team, which is actually something I do expect from my fours. If they've come through the, let's say the neuro notes and look through the imaging, I am much more understanding if, they bring up an MRI finding and they don't know what it means than if they hadn't even looked at the MRI report in the first place. Being able to present a case in a clear, organized fashion is critical. You can have limited knowledge and still make a good impression by presenting in an organized, well thought out fashion, frankly. It's probably one of the best ways to, I think, really impress faculty. And to that end, I think knowing your patients well is super helpful. The reality is, as a student and as a resident, I always failed to sort of understand how, attendings would say that having residents and students slows them down. Being on the other side of this now, 100%. And that's okay, right? Sort of the value add there, though, is you have the time and the ability to know minutiae, right? You can go into, a 100-page chart and know that particular patient much better than the resident attending, only because you've taken the time and effort to do so. I think if you're assigned a patient and this is an inpatient, know them in and out. If it's an outpatient that you're presenting, being clear and organized is critical.
Excellent advice. Absolutely. Yep. Know your patients. All right, and the last slide really for me before we get into questions, so just some bonus points. So you can ask to shadow, like Dr. Char was saying, you can ask to meet people in areas that might not be offered, but especially if there's something that you're interested in, that can show interest. So if there's, you know, a sports medicine clinic that you hear about and you're more on inpatient, you can ask, you know, on Friday, can I, you know, go shadow the sports medicine clinic? I'm really excited about it. And, you know, I won't have this opportunity otherwise. Or, you know, oh, I really want to see this EMG. And I heard that you guys do it on Thursday afternoons. Would that be okay? Or, you know, oh, I was really interested in prosthetics orthotics. Can I see that? Or the wound care clinic, whatever it is, you know, if you're interested in seeing that, or maybe working with a certain attending, maybe if they, if there's somebody you're interested in shadowing in particular as well, just say, hey, I would love to do that. Is there a way I could make that work even for a day? And usually people not only are very accommodating, but they're excited that you have a certain interest, and they're happy to do that for you. I personally love bringing food on the last day. I'm a big fan of donuts. That's just a thing that I'm used to in the South. But if there's a dish you love to make, I know there's a visiting student over at Beaumont that made this amazing, like, you know, big stew that was, you know, from their culture, and everybody just ate it up. It was amazing. You know, it's very much not necessary, but you know, people remember that. It can help sometimes. Also, just, you know, get to know the program manager and the residents too. They have a say as well. It's not just the attendings. The program manager especially, you know, they're in on these meetings for interviews and everything else. They have a bigger say than you might think. And the residents, you know, they aren't always asked for their opinion, but if they have a strong one, they'll be sure to let people know. So, you know, just make a good impression. Everybody matters, even the staff, the other staff, you know, the nurses, everybody else, they're watching too, and they matter. You might, a lot of different rotations automatically have a presentation that they want you to do towards the end. Then they can like talk about it on the letter and other things like that. Some rotations don't necessarily do that. And if you're excited about something, or, you know, you see that they do lectures at a certain time, you can say, oh, you know, like, I don't know if it's, you know, if it's possible, but I'd love to present on this one little thing. You know, maybe it's something that you can educate the residents about too, if it's a little bit more of a niche thing that can help. And then I found that scheduling a meeting with the program director at the end, or somebody like that, can be really helpful. Maybe the chair as well. Usually it's the program director though, is what I found. But it might vary depending on the place. Tell them that you really enjoyed being there and what you liked in particular, and that you're interested in being there if you really are. That can go a very, very long way if you show genuine interest. And then I wrote thank yous. I didn't necessarily see a lot of different attendings, so I just wrote like 4 thank yous for the attendings that I was able to be with, and I just gave it to them at the end of the time that I saw, or if I wasn't able to see them later, I gave them to the program manager to give to the attendees there. And you know, I never got feedback from that, but maybe it's a Southern thing, but I think it can help people too. Yeah, that's it for me, Dr. Chowdhury.
Yeah, I love it. I didn't bring food on any of my last days, but definitely I think that's a way to sort of leave a capstone. In terms of presentations, with our visiting rotations, that's actually built into our expectations of the rotation. I think it was great advice to sort of solicit case reports. It's a great way to get publications. I think certainly asking if you can do some research is important. You know, I do like that you guys mentioned bringing sort of an open mind to the rotation, doing something that you don't necessarily have at your home institution. Alternatively, if you're someone that knows you want to do spinal cord injury, for example, loading up on that's not necessarily a bad thing. It's a way to network in that field specifically. Again, that's a little bit less common. I went into physiatry not knowing at all what in physiatry I wanted to do. And if you're undecided, that's great. Do take a little taste of everything. But if you're someone who knows you want to do sports medicine, then do audition rotations at programs that are strong in sports, right? It's going to be ultimately most beneficial for your career. I cannot emphasize enough how important networking is. If I were a student now, I certainly don't think I'd match. There's so many skills that you will have that I didn't utilize and I didn't possess myself. Whether it's cold emailing people, I'm always so impressed. I recently published something in the Purple Journal. There are all these students that email me and say, "Hey, I saw your article in the recent journal. Are you doing any research?" I don't have any openings, unfortunately. I have too many residents and students as it is, but things like that are just remarkable. I never did any of that. I wasn't involved in national societies, which is much more common these days. Back then, if a student went to FAAPMR, I was like, wow, it's going to be the president of FAAPMR one day, but that's much more common. I think certainly being familiar with that environment is important. It's not just the residents and the attendings. Depending on the program, will elicit feedback or solicit feedback from, nurses and therapists and social workers. The reality is there's nothing that's more team-based than physiatry. And so, you never know who's going to have something positive or negative to say about you. So I'd be aware of that. So if you're someone like me who tends to say things that may be off-putting, wait until you're off the clock.
Awesome. All right, let's get into some questions.
I have a question.
Yes.
Hi, Jackson, fourth year from BCom. Thanks very much for the presentation. This was super awesome. And Dr. Chowdhury, thank you especially for being honest about, what you wish you had done differently. I had a question regarding answering the question why you got into PM&R. So I actually got into it because I want to treat concussions. I've had them myself. They stink, and I want to help people get better. But my question and maybe my fear is that in sharing that, I don't want to sort of be viewed as someone with concussions, with like a mild traumatic brain injury. So what do you think is better? Maybe just leave that part out. There's a lot of other things I like about physiatry, and you can be totally honest. Thanks a lot.
Great question. It's super easy. If you're at a program or working with a faculty member who views the fact that you had or have a concussion negatively, that's not somewhere you want to work. Simple as that. That's it. There's nothing else to talk about. I mean, that is as simple and straightforward as it gets. I love that. Be open, be honest, and then great. That's a fantastic personal filter.
Okay. Yeah. Thank you.
I cannot be more vehement in answering that. I mean, that is not somewhere you want to be.
Okay. Thank you.
That is so wonderful to hear. I have a mentor in PM&R who had a concussion as well, and she was told that we recently had a discussion about this. She had gotten some feedback at some point that she shouldn't tell anyone about that, and that was like really off-putting to her. And I think when I was on away rotations, I didn't know how much to share about myself and like my ADHD, because it does. If it's really hard when I'm in a new situation, and sometimes clinics can be really overwhelming if you don't know like how they work. So I didn't know how much of that to share. I ended up for the most part just kind of not doing that at the beginning, just kind of, but I don't know, for me, it was just more like a vibe thing. But I wish I had been more like Dr. Chowdhury and been like, I could just share this and then it won't be an issue. I think that would have helped a lot. But I say, you do you. I think this attending still goes off and tells people about her concussion because I think it does help her connect more with patients. And really, I think doctors have a lot of medical issues, and I think it's probably a better place, but it's a better world if we start sharing those and start admitting that we're human.
Listen, I mean, I don't think, your medical history should be part of your elevator pitch. I don't think you should say, hey,
Yeah.
I'm Nasim Chowdhury, I have a drinking problem. Like it's not, like I concussed myself falling down the stairs,
Yeah.
or hey, I have raging ADHD. It's not how you want to start, certainly, right? But I think that example that you gave is a perfect segue to talk about that, right? I think the example that you mentioned about the ADHD, certainly, right? If there's a patient that you're treating that happens to have that, sort of a one-liner about, hey, I can identify with that, I think is totally appropriate. The reality is, are there potential bad apples that, will view that negatively? Sure, right? As I mentioned, attendings are human as well. You're gonna have good apples, you're gonna have bad apples. It's no different than those programs that perhaps treat female residents who get pregnant not well, right? And so those are programs to avoid. I would not in any way, shape, or form, especially for physiatry, be uncomfortable talking about those things.
Thank you both so much.
Great advice. Anybody else have questions?
Hey, Dr. Chowdhury, thanks again for the presentation. Not really dealing with the weight rotations, but kind of just quickly your story. Did you always know you wanted to do academics, or was that something that you kind of figured out during your residency?
I think I always knew I wanted to be in academic medicine. What's interesting about our field is that the vast majority of your training is done in an academic setting with academic physicians, even though the majority of our field is non-academic, right? If you look at the numbers of sort of academic physiatrists and non-academic physiatrists, the numbers are skewed in the sort of non-academic sort of setting. So I guess I didn't know any better. But as I progressed through my training, I realized that I liked complex patients. And so that sort of relegated me to the realm of academia. I also enjoyed working with residents and teaching. So again, same sort of thing. You're generally speaking talking about academia. I was all over the place. I was thinking pain for a little bit, and then sports and spine, and thought about general rehab, somewhere in Middle America, and then sort of ended up going straight to practice, but created, sort of developed a cancer program at Cornell. So I was all over the place. But generally speaking, I knew academia was where I wanted to be. And then it's 10:30 here in New York. I'm actually off to the movies with my wife, but I want to see if there are any sort of last questions before I step away.
Thank you. We have one more question, if you don't mind. This is
please.
Is it safe to tell a program by the end of an await rotation that they are high on your list?
Yes, the good old, what do I tell a program? So, yes, I think, again, don't quote me directly on the GME rules. Certainly, I, at least when I was a student or a resident, you were not allowed to say that I'm ranking you number X or number Y. I think that still holds. But I think giving a sort of general idea to the program is not unreasonable. I think if it's done in an open fashion, hey, really enjoyed this rotation. Certainly this is a program that I'm very, very strongly considering. It's going to be, high on my list is reasonable. And I think programs do that as well. Again, don't quote me on these sort of GME specifics, but I do not think you're allowed to give an exact number. Hey, I'm ranking you one, and vice versa. All right, great. Please feel free to shoot me an email if you have any questions. So great talking to you all and meeting you all.
Thank you so much again. Thank you. Enjoy the movies with your wife.
Thanks.
All right.
Thank you.
I know.
Thanks. Bye. It was so lovely having you. While Dr. Chowdhury heads out to the movies, just want to ask any more like last minute questions. I did not realize that you couldn't tell programs that they were your number one. I think an easy question I had for a lot of my programs is like, oh, I would love to match here. How do I match here? How did you do it, etc. That was an easy way to show interest.
Yeah, I would say, so what I did is I told the programs that were not number one, I said, I'm ranking you very highly. I used the word high, yeah, highly. And then my number one, I said, you're my top program. So I was told by other residents that was okay to do. And I think as long as it's done like, just like open, genuine fashion, and you don't tell somebody who's not your top that they're your top, I think it should be okay. Any other questions?
Hey, I do have a question. I am doing an away rotation at UAB starting next week.
It's hard to hear you. Sorry.
Can you hear me? Sorry.
Yeah, it's better. Go ahead.
Oh, no,
you're
sorry,
muted now.
Now you're muted. Try one more time.
Sorry. Can you hear me now?
Yeah.
Sorry, we're in the car traveling. I am doing an away rotation starting next week in PEDS PM&R. My home program does not have any PM&R at all, much less anything pediatrics. I have done some outpatient shadowing of a PM&R, and I have a strong background in pediatrics and just finished my PEDS sub-I. But how should I prepare for this, since it's what I'm interested in doing, but I haven't had exposure yet? There's not a lot of resources.
No, there isn't. I'm trying to look. I think there is a chapter on PEDS rehab and PM&R recap. I just verified, and I think it was good if I remember correctly. But that's only one chapter. There's just look in different books. I think there might as well, like at least in Pocketpedia and other ones, like there's usually like a chapter on like review books on PEDS, and that can give you like a good overview. But what might work for you is at the very beginning, ask them, say, hey, like, what do you guys recommend that I look at and like read up on? They can give you a really good answer. I'm not 100% sure on PEDS specific, but I know a lot of like review things will just have like a chapter on it.
Okay, thank you.
Yeah, I would say, I mean, if you do end up getting a subscription to PM&R Recap, but they do have, I believe, a lecture on pediatric rehab that honestly I haven't looked at yet, but that's my next rotation. And I agree, like you, I'm like, I have no idea what this entails. One of the things I did look at a lot, and I'll drop the links in the Google Doc, is so a lot of PM&R of what we do is like interdisciplinary. There's also like different fields that do sort of the same, that deal with kind of the same pathologies that we do. So I would listen to, so for example, for pediatrics, I would listen to the Ortho Bullets podcast. They do have a couple of pediatric lectures on like spina bifida and whatnot, hip dysplasias. They also, just in general, we work a lot with orthos. So like I listened to their spinal stenosis stuff. It was even helpful, honestly, when I, like during residency. But also like I found YouTube and like podcasts to be super helpful. I quickly searched, I couldn't find any good pediatrics rehab things, but again, like the things that you would mainly see, cerebral palsy a lot, I think like spina bifida. So I would just kind of choose those topics. I will pull out some of the main topics that they talk about in our board review sections. And again, I would just kind of look that up and yeah, I would really just focus on those.
Thank you.
Roxy, did you see the last message on the chat?
Thank you. Yes, I saw it. Or no, I didn't see it until now. I am gonna drop the link. It'll be on our website. I have not put it up yet. It'll be in our applying into PM&R section. I can send it out. I think Zoom will give me your emails, but if they do not, I would just look at the applying into PM&R section of our site, and I'll put it up right after this.
Awesome.
Cool. Any other questions? No. If there aren't any more, sorry,
Did you mean to send a link?
I did not send the link yet because for some
Oh.
reason it didn't let me paste it in there.
All right.
But also, let me just like finish editing it. I will say that if anyone wants to join our Slack, you are more than welcome to join, and then you can just ask all of the residents questions on there as well. Yeah, we're all super excited and pumped about PM&R, and it's really hard kind of finding resources and other residents. So yeah, just feel free to ask us questions anytime.
So if we want the Google Doc that you're making, should we join the Slack because that's where you're gonna get it, or do you because we signed in to get into here? Do you have our email?
Sure. Yes, I do. Let me post it. I think the easiest thing to do would be I can email it out, but I will also just kind of post it to our social media and stuff. It'll just be a link on our page.
Okay, thank you. Sorry.
Yeah, no worries. Thanks. I think that might be it. Okay. Guys, definitely just join the Slack. Just reach out anytime you have any questions. I will put this up soon. Thank you, everyone.
Sounds good. Thanks for coming.
Thanks so much. Bye, everyone. Have a good day.